Hey, good morning, everybody. This is Brittany Jennings coming to you live from the Seniors Blue Book. Happy Monday morning. Here it is again, bright and sunny on this Monday morning. And today I am so excited. I am joined by Erika Stupiello of Home Helpers of Sarasota. Good morning, Erika.
Hi, Brittany. Good morning.
How are you today?
I'm good. Thank you. I'm so happy to be here with you.
I'm very happy you're here too. We've gotten to know each other pretty quickly here over the last, I would say, couple weeks, and I'm just really excited for your business and where things are headed for you. So, without further ado, would you mind sharing a little bit about your personal background and your story?
Sure. Home Helpers is really very near and dear to my heart. Is my encore career, what I chose to be doing the second part of my life, I call it. I'm originally from Brazil. I had a very different professional background there in Brazil. I was a professor. I'm also a certified translator, and I have a PhD in linguistics. So when we immigrated here to the United States 2 years ago to be with our son, it was a choice my husband and I made to support him in his choice and his dream of becoming a pilot for the U.S. Air Force. And we feel so proud that now he is, accomplishing that and working hard in the ROTC program at the university where he is going and doing his aeronautical science program. We decided that we wanted to choose a career path or to have a business that would allow us to serve the community that has welcomed us to this country. So becoming an owner of Home Helpers allowed me not only a chance to do that, but also I wanted, in order to be efficient in what I chose, I wanted also to learn more about what it is like to be a caregiver. So I went to training with the American Red Cross. I became a CNA, and I also wanted to understand aging, the aging process, so I also became a certified senior advisor. So I'm very, very honored to be serving Sarasota County as the owner of Home Helpers.
Awesome. Well, I would love to also, before we jump into a little bit about what Home Helpers does, your mission, what are some of the things maybe either creatively or that you've done to find peace, just personally during this quarantine time?
Yes, I'm a very active person, and because, I'm also a translator, I am always working at, sitting at the computer. I like very much to run. I've run 3 marathons already, but, with quarantine and all and stay-at-home orders, I've turned into yoga. So I found this really cool yoga program, this yoga challenge, and I started doing it for 30 days. So it has really helped me, develop more this inner look and this inner peace. So it has been really helpful. And also I've been binging on Netflix and everything when I have time, like everyone else, Ozark and all these TV shows that are just great.
Yeah, this weekend I was trying so hard to find something new to capture me, to get like addicted to again on Netflix, because I swear we've probably gone through like 10 or 12 different series, including Ozark. So and Tiger King.
Tiger King, yes.
So Erika, give us kind of a rundown about Home Helpers. What type of services do you provide in homes, in communities, the environments you serve? Give us a little rundown.
Sure. Our mission is really to make life easier for our clients and for their children. What we really want is for the son and the daughter really to feel that their mom and dad are being well taken care of in their home, they're safe and they're healthy. So we provide services, from companionship for those to be more independent but need a little help and company at home. Also to personal care when you need more hands-on care, from helping, with activities of daily living, but also helping the person, our client, to be connected to their loved ones. If they're not at home, being connected online, being able to access social media, being engaged in their communities, not now, of course, but we are sure that they can, our clients can go safely to church, to medical appointments. We also help them keep track of their medication, making sure that they're staying healthy and they are complying with their doctor's prescriptions and everything. We also help with their nutrition. Sometimes when you are alone, you don't pay much attention to what you are eating. So our caregivers also help our clients prepare meals, make sure that they have a healthy diet. And to complement our services, we also offer a line of emergency response systems and also medication reminders that ends when our caregivers are not physically present with them. So it's an extra layer of safety and comfort for our clients.
That's amazing. I think we should do a little show and tell. And
Sure.
Let's see the emergency response system. Can we see what that looks like?
Of course. This is one of the devices we install in our client's home. The client can get free of charge if they hire 20 or more hours of care per week. So for example, a client can be with us during the day, and maybe at night, if he or she wakes up confused, not knowing where they are, if they sometimes cannot reach their cell phone or any kind of communication, they can just press this button here, and this will connect immediately to our call center. And our call center will have all the information of who should they call, what is the primary emergency contact for that person, or if they should call for help, like first responders if needed. And even if this is the case, they will give all the instructions to the first responders for example, how to get into the house, where the key is, or if the door is locked or not. So it's an extra layer of safety for the client. So this is the emergency response systems. We also have the fall detectors or fall sensors that, those are the pendants that our clients can wear. And we also have the medication reminders like this. So we program here the time the client has to take the medication, and then at the right time, this little door here will open, and just that medication for that specific time will be available for the client. Many people have this, some people offer this kind of medication dispenser, but what is different in ours is that if a client, for example, does not take the medication or doesn't hear the alert when it's time to take the medication, our call center will call the client and remind him or her of the medication, or ask why they did not take the medication. So this is a different service we offer. This is what differentiates us from other systems that are out there. So we offer this as a complement to our services. Mm-hmm.
I think, one of the biggest goals, and maybe the biggest goal for providing care, is safety. Families and obviously mm-hmm. the client themselves, they want to feel safe. They want to feel by the caregiver, by the company itself, that you're providing certain measures that will take great care of them. And I think these things that you have are they're unique, of course, and they're additional to the caregivers you're providing for true safety in the home. And so these types of things, now you mentioned the emergency response, that's if somebody hires 20 hours, was that per week?
Yes, 20 hours per week. Mm-hmm.
Okay. And then the medication system as well. How does that kind of work for people that are watching? If they do hire you on, how do they get to take advantage of that as well?
Well, they also can get the medication dispenser, at no cost for them if they get 20 hours or more per week with us. So it is a great complement, as I said, when they are, for example, if they choose to have care in the morning and in the afternoon, they prefer to stay in their home, they don't need care like for the full day, so they can get these extra devices that will help them stay safe. And safety is really, really important nowadays. And it has always been. And I think in-home care can provide that very efficiently because home is where we feel the safest.
And you mentioned too, before we jumped on, that you're offering a 2-hour free trial.
Exactly. Yes, we really wanted, because home care is, so important in terms of not only safety, but now when we talk about infection prevention and control, because we're talking about one-to-one care. So we want to offer future clients the opportunity to test us, to really see our services and what in-home care can do for them, because sometimes we get calls and people really don't know what they need. They think they need help like for 2 hours, and then they see all the good things that our caregivers can do for them and how good it is to have company there, to share stories, to share hobbies with someone, and even to be able to have someone help them in the services that they need. So we're offering for clients to be able to try our services, 2 hours of free care, so people can see all the benefits of what in-home care and our home helpers can offer them.
Sounds amazing. Well, is there any other maybe information or pieces of advice that you'd like to share with people out there that are watching?
Yes. What I think it is really important for people nowadays is really to make sure that when they are staying at home, they have, good ways of preventing falls, of preventing anything that can take them to other settings like a hospital that can put them at risk. So one of them is keeping exercising. This is really important. So our caregivers can also encourage our clients to, just take a walk around the block and keep exercising, keep active. This is really important to prevent falls. And also keep a good nutrition, to keep strong. So this is something also our caregivers can help. So I think keeping a good health, good nutrition, and keeping strong in terms of exercises are a good way for us to keep healthy and avoid infections like what we are having, unfortunately, now due to COVID-19. One thing that we do also to help prevent falls is we do before we start care, we do a free in-home assessment, and we evaluate potential dangers or hazards that can put the person at risk for falls. So we do this complete fall prevention assessment for our clients as well.
That's amazing. And that's all like so helpful. And I think with everything going on right now, I think it would be a good question to ask with those home assessments. Is it kind of case by case, or how is that working right now kind of amidst COVID-19?
Mm-hmm. Yes, it is a case by case, but we are always very careful of all the personal protective equipment we wear. Our caregivers have all the equipment they need to be able to provide safe care. But yes, it is a case by case. We analyze each in-home, each home. I always tell my caregivers that they go to a home that I first have, was there before. Providing this free assessment is a way not only to guarantee that a client will stay, away from any danger of falls, but it will also help our caregivers make sure that the client stays safe.
Absolutely. Well, this is awesome. I'm so excited for you. And I know you're up and running, and this just happened for you in March. And so I'm just really excited to partner with you and help share your message and your story, because you're just an amazing human being. So thank you so much for making this your mission. So if anybody wants more information, I will put everything in the post, but what would be the easiest way to get a hold of you, Erika?
Thank you, Brittany. Yes, you can, call me anytime. Call us at 941. 866-0393, or you can visit our website to learn more about the services we provide. It's www.homehomepers.com/Sarasota-Florida, FL.
And I do have real quick while we're on here, I do have your website pulled up, so we can just flip over to that just so people can see that. So there's a lot of great information on this website. And of course, here is the phone number that Erika mentioned to call. And so, yeah, so and here's some of those, like you said, like the monitoring services, all the care services that are available. This is great information. So just check this out, and I'll put this in the post as well. But Home Helpers, homecare.com/Sarasota-Florida. And you'll be able to find all of Erika's information. So, Erika, thank you so much for joining us this morning. You know, it's Monday, so the coffee is flowing. And I love starting out Monday with you. So
thank you.
Absolutely. Well, I hope you have a great rest of your day, and we'll see you soon.
Okay. Thank you, Brittany. Thank you so much for having me.
Thank you.